I'm actually very pleased that I was still able to make it here tonight. I actually have another engagement, but I can never say no to Medical City. I love the Medical City. And maybe, thank you. And maybe you'll ask me why. Just yesterday, I think 2 days ago, I was invited to say a few words and tell my story of how I became a partner of the Medical City. So it was about a year ago when I came into the Medical City as a patient, and I was relating the story, as Dr. Bengson would say. I never forget to mention Dr. Balburias' name, but that is true. He was the first attending physician who asked me a whole lot of questions, and I was wondering why. Why would someone want too many questions answered, and what for? Is he a stalker? What does he want to know about me, including my emotional background, my ethnicity, everything, my lifestyle, what time I ate, what time I worked out, and all of these things. And then I realized that was the true meaning of the phrase, where patients are partners. Because I looked at it and I said, how can a patient be a partner when it's the patient spending and it's the patient that's in distress, and here's the doctor breathing down his throat and telling him this is what you need to do, this, that. And he's just wondering and saying, yes, yes, yes. So that's when I realized that in the Medical City, it's different. Patients are partners because patients are actually encouraged to speak, to communicate, and to collaborate with the doctor in his walk towards wellness. A patient is encouraged to make a decision to be healed. A patient is given the confidence and the assurance that he is taken care of, that he is safe, that he is sound. A patient is given the smile that the patient needs when he's worried, when he's afraid. There's that beautiful nurse's face that says, "Good morning, ma'am. Are you okay?" And now I was sitting in my chair and I was thinking, I'm asked to say a few words and I'm not really prepared, because I said, I don't write anything, I just speak from the heart. And I thought, what would the core be of patient partnership? And then the answer came to my mind and I thought, it's communication. I guess we all know that if we have partners, it's a relationship. A partnership starts from talking to the other person, hearing the other person, listening to the other person's needs, and wanting to satisfy that person's needs. It's a collaboration. You don't become a partner and you're just talking and talking and the other person is not talking. You listen, you stop, and you communicate. You react. So that's the core of what the Medical City is doing right now. They've even gone as far as putting up websites, even going to YouTube, Wikipedia. This is this hand reaching out and saying, hey, I'm your partner. I don't do anything if I don't consult you. Unlike other hospitals where information is withheld from you, here the doctor tells you what you need and why you need it. And then you both make the decision to go on and decide, okay, we want to be well. We want to walk to wellness together. So let me hold your hand and we will walk our talk. Let's get well together, because again, a patient can never be healed unless he makes the decision to be healed. So for all of you tonight who are going to be awardees of patient partnership, I tip my hat off to you. Kudos to all of you for being such good patient partners, because you are the ones who give an assuring smile. You are the ones who walk your talk. You are the ones who walk the extra mile. And you are the ones who are going to put the Medical City into that apex of all, where people will say, this is the city of medicine. For after all, Medical City, or the City of Medicine, is a place where people converge who would like to address their medical needs and medical requirements. The walk towards wellness, the walk towards health, the walk towards wealth. Congratulations, everyone.
Thank you.
Thank you, Ms. Bonavie, a true TMC patient partner. Because of our unique philosophy, the community really tries to live out and concretize patient partnership daily. And this contest that we have, the I Am a Patient Partner Competition, is a way for us not only to gauge how well we understand and how we live out this philosophy. What better affirmation than what Ms. Dina Bonavie has mentioned, but also to motivate all of us to even be more conscious, exert a conscious effort, be more active in practicing, promoting, living out this philosophy from the heart. To briefly recap everyone on the mechanics, all Medical City employees were invited to submit a short statement revealing why they are a patient partner. We received over 300 entries, that's a lot. And we only considered having 5 winners. 1 doctor, 1 nurse, 1 from the Special Services and Allied Services, 1 from the administrative staff, and 1 from our outsourced personnel. Tonight also is a night full of surprises, not just the awarding ceremonies. So stay put, sit back, enjoy this culminating program, and please give a very warm round of applause for our hosts for tonight, Ms. Carla Diwa and Mr. Adrian Gonzaga.
Thank you so much, Dr.
Thank you.
Risa. Good afternoon, everyone.
Good afternoon, TMC!
Again, I'm Carla Diwa.
And I'm Adrian Gonzaga, and welcome to this night's event.
Good afternoon.
How are you, Ma'am
again.
Carla?
Good. How about you?
You're looking lovely as always.
Thank you.
I think lovely is understating it, huh?
You're so gorgeous yourself,
Yeah.
Adrian.
Oh, thank you.
Okay, before we start, we'd like to again thank everyone here present and patiently really waited to start this program. And of course, we'd like to acknowledge the presence of the members of the G5, starting with our President and CEO, Dr. Alfredo R.A. Bengson. My boss, Ms. Margaret Bengson, the head of the Strategic Services Group. The Senior Vice President of the Patient Services Group, Ms. Virginia Bialano. Of course, the Senior Vice President of the Finance and Administrative Services Group, Ms. Benita J. Macalagay. And of course, the members of our G42, our clinical department heads, our special guests, and the rest of the medical city for being with us today.
Yeah, that's right, Ma'am Carla. It's a very exciting evening we will have tonight, right?
Yeah.
And it's actually translating into and becoming an anxiety for me because I don't know what's going to happen exactly. You know? I don't know everything. But anyway, I just want to throw a question to you. Why are we here in the first place? Anyone can answer that, but I've heard someone days ago saying, "What are we having this entire week?" And I'm just furious because what the hell? It's our anniversary. It's our anniversary.
It's our anniversary today. Okay.
So, but the essence of this entire week, do we really digest the essence of this entire week?
Yeah.
What are we having, Ma'am Carla?
We have today, Adrian, actually marks the last day of our 4-day
Yes.
celebration of the medical cities. Ilang taon na tayo? 43rd year anniversary. And what's our theme for our this
and
year's anniversary, Adrian?
Yeah, and the theme for this year's anniversary is establishing the pillars of growth and leadership. Hopefully, this entire week of activities, we will be able to digest what we have learned about how the medical city has progressed and become a true leader in the realm of Philippine healthcare and use it to steer us towards even greater heights in the years to come.
Yes, and as Dr. Riza has mentioned a while ago, the I Am Patient Partner Contest is an excellent way to see how dedicated each of one is to furthering the hospital as a unique, world-class healthcare institution. So, Dr. Riza, can I ask you how you have become a patient partner? Mauna ka daw, Doc.
Consultant Director of the Center for Patient Partnership. I make a conscious effort day to day in my work to uphold and protect the patient's rights. I am Risa Valdez, a Medical City patient partner.
Wow. Very nice statement.
Thank you very much, Dr. Valdez.
Okay, for our statement, Adrian.
Okay, we will do this. Okay, so I am a patient partner and I am a trainer. And because I am a trainer, I take it upon myself to teach and to teach well. Because although I don't have any direct impact in the lives of our patients, but I know that I have a huge responsibility as an instrument of learning, which in turn translates into actions done by our staff. Thus, every commendation or merit received by any person or any of the trainees that I have produced, I have handled somehow, it becomes a reflection of how I am as a patient partner.
Haba. Okay, since mahaba yung statement mo, yung sa akin sobrang ikli na lang ha.
Bullets lang
Okay.
yun, Binullets ko na lang.
Okay, I'm Carla Diwa. I'm the Senior Manager of the Systems and Quality Department. I'm a patient partner because I ensure that all of the new processes, all the policies are really geared towards our patients and ensuring that we all comply the standards of excellence, the Joint Commission International. I'm Carla Diwa.
And you play a very, very essential role in the medical system.
Okay.
Yeah.
Ilan nga yung entry, sabi kanina ni Dr. Risa na nagpadala? It's about 300.
About 300, I
About
guess.
300. But for today, we're just going to hear some of the top 25 statements. Okay.
Yeah,
To
let's
start off,
Yeah.
puntahan na natin yung unang-una.
I'll be in this.
Magsasabi kung bakit siya patient partner.
I'll be on this side.
Okay, sir. Sir Arman.
My name is Arman Artos, representatives of Lloyd Aposikit. I am a housekeeper. I make sure that the hospital surroundings are clean so that patients, our relatives, are not exposed to any infection. I am a patient partner.
Thank you so much. Who's
Wow.
next, Adrian?
Yeah. On this side, we have